Hello, I'm Lynn Dimer and I've been working with the National Heart Foundation now for 16 years. Why have I stayed there so long? Because I really have a passion and I'm committed to making a difference with my people in understanding their heart health journey. We've produced a series of video clips that will help you understand about the heart and heart disease. We hope that this will help you better look after yourself, your family and your community.
An artery is what we were talking about on the wrist here, and we know it's an artery because we can feel the pulse. So we can feel it beating away. And that means that the heart has sent blood to my wrist, or in the case if you feel in your feet, you'll feel your pulses in your feet and the blood from your heart is pumping out. The other blood supply that you have is your veins. And they're these ones here on your side of your arms and all over your body. So you'll see them on your legs. So the veins don't have a pulse. So when you touch them, they don't pulsate. And what they're doing is they're sending blood back to your heart. So your heart has three major blood supplies. One runs down the right side, one runs down the left and down the front, and one runs down the left around the back. Just like a tree. Your branch has a major trunk, just like your heart does. It has one branch going off to your right, which has sub-branches, and it has a smaller one here off to the left, and then it has another major one off the left here. Your arteries, when you're born, they're nice and clean and hollow. Gradually over time, your blood vessels will start to narrow off. Unfortunately with some people, as they narrow off to the point where a clot forms. Everybody will present with different symptoms for the narrowing of the blood vessels. We had a lady recently who, when she'd get off the train to come to the heart program, she'd walk 200 or 300 metres and then she'd get some stomach pain, just sort of below her ribs. She'd stop and have a rest and the stomach pain would go away. Then she'd carry on walking another 200 or 300 metres and the stomach pain would come back again. I had to talk to her and she said she'd had that pain go on and off for the last 2 years. So we sent her off for a test, and what we found with her was that a couple of her blood vessels in the heart, these ones here, had started to narrow off just like this. So she didn't get the classic, what the Heart Foundation would say, left side of the chest coming down the left arm. Some people get it in the shoulders and the neck. I've had one Aboriginal guy not so long ago who has quite severe diabetes, and with diabetes you don't get the same nerve sensations, and you'll see those Aboriginal men with sores on their feet and they don't even know they've got cuts on their feet, which are quite painful. So for him, he wasn't getting the same pain sensations, but what happened was he went quite white, he went sort of wodular white, got quite short of breath, and felt unwell and lightheaded, and that was his sign that he was having a heart attack. So it's important to ring 000 and get an ambulance to your house as quickly, or wherever you are, as quickly as possible. It's important that we get into hospital quickly. We listen to our family and friends, and it's important that you tell your family and friends what's going on with your symptoms so that they can then support you.